COVID cases are declining, but hospitalizations are up. That was part of Dr. Angela Dunn's message to the Salt Lake City Council today. News specialist Matt Rascone has more on the county's response to COVID and their plan heading into next year.
Dr. Dunn said we would likely see an uptick in cases because of Omicron. That's part of what prompted the Salt Lake County Council to once again extend their public health emergency heading into the new year.
I'll call this meeting to order for Tuesday, December 14th, 2021.
In their final council meeting of the year,
where do we say, okay, we're not in an emergency anymore?
The Salt Lake County Council voted for the 15th time.
Aye, that passes 8-1.
To extend the public health emergency that's been in place since nearly the start of the pandemic.
As long as you have the emergency outstanding, as long as we have it declared, we're going to continue to submit reimbursements.
The declaration gives the county access to federal money in their ongoing efforts to combat COVID.
The message I have today is go get vaccinated if you have not.
Keeping the emergency also makes sense for some, given an uncertain future with Omicron.
Going into the holiday season and potentially a variant coming our way that's definitely more transmissible, chances are that our cases will start to increase again.
Dr. Angela Dunn told the county council new data from South Africa showed waning immunity from the first 2 doses of the vaccine against the variant.
And it's still protective against hospitalization and death, but it is expected that a boost dose will improve that vaccine efficacy against the new variant. So more important now than ever to get the boost dose.
COVID cases are going down in Utah and headed that direction in Salt Lake County, but Dr. Dunn says hospitalizations are up.
So what that's telling me is people who are infected aren't getting tested.
Dr. Dunn suggests case numbers may not reflect the actual spread of COVID, and watching hospitalizations will be more important heading into the new year.
We've come a long way. We're still not there yet, so I guess I have some hope for the future.
Dr. Dunn also addressed home COVID tests. She says they're good for surveillance, but if you have symptoms, she suggests going in to get tested. The county council will revisit this emergency in January.